Hi, I'm Alan, security for the HRC. I want to welcome you guys to the HRC. Hopefully, if you need anything, I'll be here. Just come by and let me know. I'm here to help.
We started the HRC in 2015, and we started HRC with two missions in mind. One is to educate physical therapy students and give you opportunities to work in a clinic before you get to clinic, as well as to serve the underserved, underinsured, and uninsured of the St. Louis community. When you come to the HRC, we pair an older student with a younger student, and you guys are under the supervision of a licensed physical therapist.
There's two different roles that you can do. You can be a documenter for a treating physical therapist, or again, you can be a treating physical therapist. And you're always busy and you're always learning from licensed physical therapists giving you great feedback.
You will either do an initial eval or a follow-up with patients, and they can be knee pain, back pain, neck pain, shoulder pain. You name it, we get it.
And we get to work on any functional deficits that we see here. So it's either regards to strength, stretching.
When I came previously, I helped triage and was able to interact with a lot of patients through that. But today I came in to help document as for follow-ups and initial evals, as well as jump in and do a couple manual muscle tests and range of motion. So you get practice in all sorts of realms of physical therapy.
Today I worked with a patient who we had given a walker last time she came here to the clinic, and she walked in still not really too confident in using her walker. So today in clinic we worked on some sit to stands, using the walker properly, and then just ambulating around the clinic.
My favorite part about the HRC is not only being able to give back to the St. Louis community and the people that need our care, but it's also a great way to practice your clinical skills outside of the classroom.
I really like the HRC because although I can't come here very frequently, the times that I do, I get a lot of learning opportunities out of them.
I get to do some incredible work with other specialties, ranging from social work to medical, whether it's dentistry or whether it's eye exams or the general physical exams that they go through. We triage these patients, speak with the medical leads, and try to incorporate these patients into our time. We do real work with real patients who don't have the money or the insurance to go anywhere else. They rely on us to care for them.
A great example that I have is a patient who came to see us about 2 or 3 months ago. He is now able to be walking 5Ks. He came in before having a recent history of falls. He's now not falling anymore, and he's being a great advocate for himself and for his own care. And I believe that wouldn't have started if it wasn't for us here at the HRC.
When patients come into the HRC, they're so grateful and thankful for the care that we're able to provide them just by us looking at them, because they don't have the opportunity or the access to get treatment elsewhere.
I'm one of the lead student physical therapists with the Pro Bono HRC, one of 4 that works there. What we do is essentially patient management. We call patients every week, usually on Wednesdays and Saturdays, and we answer their phone calls and questions, and we schedule them based on their availability as well as ours. This is an extremely important part of this because as a pro bono service, there's many times where patient cancellations happen, and it's our job to make sure we fill as many spots as possible. A, so we see the most patients as possible, and B, so that our treaters, our students, get the most education that they can.
What's important to know is that if every student in your class came just one weekend throughout the year, we could cover the entire semester. So we're not asking you to commit for a lot of times, but if you can just come one. Some students come once and they find out they're very passionate about it and they want to come back, and we schedule them. But other people just come one time. But I think even if you come just one time, you will find that you have found some benefit from that time you've spent here at HRC. Hope to see you here.